Good afternoon. Today I'm going to limit my remarks entirely to Sacramento County. I'm sure that you probably are more up to date than I am on cases in the state and in the country. The information that we will be giving you today could change at any time. We are giving you the information as we receive it and as we process it. But please be aware that because this is a very new virus and we're just learning things about it, and we are all developing our procedures as we go along, that things that I may tell you one day may change the next day. As we said yesterday in a press release late in the evening, we now have 3 cases of swine flu in students of the of St. Mel. A 4th student that had visited Mexico and had been sick tested negative for any kind of influenza virus. This is not surprising, as this student was several days past being ill and was completely recovered, and you do not shed virus forever. However, what this means is that we cannot say that this student is the index case, and although by history that might be the case, we certainly have no proof of that. And since so many other families do travel to Mexico, or had traveled during the spring break, it is possible that there was another source for this swine flu virus. The Division of Public Health continues to monitor families from St. Mel, and so far today we are aware of 12 additional individuals who have reported new onset of symptoms that are consistent with influenza-like virus illness. The staff is determining whether or not these individuals should be tested for swine flu, and it is right now our procedure not to ask people who might have swine flu, who might have been exposed to a case of swine flu that we know of, to seek services in a clinic or in a hospital. Our staff is going to their homes to do the testing, and that way we can restrict any exposure. As the number of cases increases, we may have to change that because we do have limited resources. But at this time, we continue to do this. In addition to these 3 cases, we now also have a healthcare worker who has tested positive for influenza A, and it is unsubtypable in our lab. We reported yesterday that we were not sending specimens on, but this particular specimen is going to the state public health lab because they now have the same resources as CDC. They will be able to do the actual testing for swine flu at the state lab in Richmond. So we're going to take advantage of that and have them confirm all our cases. So at this point, this particular specimen will be going there. So we are calling this case a probable case of swine flu. However, we are instituting a case contact investigation, as we normally have been doing for all the cases of swine flu that we have in this county. The healthcare facility where this individual works is being fully cooperative, and we really appreciate their willingness to work with us in order to try to contain the spread of this illness. Our public health laboratory is testing, I know this was asked yesterday, about 50 specimens today. They tested about 40 yesterday. Because the response in our medical community has been so positive, we actually have 2 requests to make of our clinicians in our community. The first one is viral transport media. That is the media that the specimens are put in to be transported to the lab. Our lab is really running short of that transport media, and unfortunately our budget is restricted. We cannot really purchase a whole lot more. So we are asking physicians in our community to try to find this transport media through their own organizations if they can. We will continue to distribute as much of it as we can, but we have limited resources to do so. In addition, we are asking clinicians in our community, and this is a change from what we said Thursday of last week, to restrict testing to people who are actually sick with influenza-like illness. That means a temperature of 100.4 or more, cough, congestion, achiness, and or headache, and who may have been exposed to someone who has traveled to an area that has swine flu in the community, such as San Diego or such as Mexico, or has been exposed to a case that's known to have swine flu. So this is, again, a change from what we had requested on Thursday. And a K-hand alert went out to our medical community last night, but everyone may not have read it. So we appreciate it if you also say this. The interest in our community is also great. We are getting a lot of calls from folks who just want to know what the symptoms are and what they can do to protect themselves. The County and City of Sacramento Office of Emergency Services has worked with 211 to have information about swine flu there. So they are recommending, and so are we, encouraging the public who has questions about swine flu, who are interested in knowing what to do to protect themselves, to call 211. They have personnel there who have been trained and will be able to answer most questions. The other thing that we are finding is that many people are calling our offices with symptoms and wondering if we can tell them whether or not they are ill or what to do. And public health deals with community issues. We don't really deal with individual patients. So our recommendation to people who have a personal health problem is that they really should call their physician and speak with their physician about what they have and talk with their physician about whether or not they ought to be tested prior to going to the physician's office. For those people who do not have a physician, continue to call us and we will try to connect you with a community clinic that might be able to help you. I think I'm going to stop there and answer any questions that you may have.